Yeah. So hello, everyone, and welcome back for those of you who's been joining us in the last few evenings. We're very excited to be with you all tonight. We have a wonderful session again planned. But tonight we wanted to talk a little bit about, the Indian Gurukul. And for those of you who don't know, the Indian Gurukul is a year-long course. It's extremely comprehensive. We are, teaching you and guiding you in becoming, the best practitioner and refining all of the skills that you have. And this is our most comprehensive course. And it's also the one where you have the most sort of contact with Dr. Sankaran. So as the name Gurukul suggests, you are there with Dr. Sankaran, meeting with him monthly, multiple times in a month, watching his cases, having access to all sorts of content that is not available to anyone else or on any other platform. So it really is a once-in-a-lifetime opportunity. And this is now the fourth batch of Gurukul, which we will be holding. The first three having been extremely successful and everyone really, benefiting. And as part of that tonight, we're going to see some amazing cases presented. We have two wonderful doctors with us tonight, Dr. Manish Jagpal from Ludhiana, Punjab, and Dr. Piyush Gupta, also from Punjab. So they have both been members of the first batch of Gurukul, and we'll see, really incredible cases that they will show us, showing us, everything that you see in their cases tonight. You can learn if you're interested. Every aspect that they will show you, you have the possibility to learn by joining the Gurukul and taking up this opportunity. So we'll talk a little bit more about how to join, where to join, etc. At the end of the session. But I think it would be good to start with our cases. And Dr. Sankaran was also here with us tonight. He will also be sharing with us his thoughts on cases and these different aspects. We talk about things like superclasses, five-finger approach, miasms, kingdoms, sensation, all of this we'll be talking about. And so watch these cases, be inspired. And if you would also like to, reach to where these doctors are reaching and do what they are doing and do what Dr. Sankaran is doing, then keep in mind the Indian Gurukul, because it really is an amazing opportunity. And we would love as many people as possible to, apply for it and take on the challenge. But I think let's get going. We're all here to learn homeopathy after all. So we're very excited, and I would love to ask Dr. Piyush if he could share with us his presentation for today.
Yeah, thanks, Kyle. Good evening, everyone. So I'll be sharing my PPT now. Is the screen visible? Hello?
Yes, Piyush, it is visible.
Yeah. Thank you, brother. So let me first introduce you with the aim of the presentation. The aim of presentation is not just to show that I have done such a wonderful case or this pathology can be treated. It's not the biggest pathologies, even bigger pathologies will be coming. But the aim of this my presentation is to just convey to you that how the learnings in Gurukul come to practice and they fine tune your prescription. We were already getting results. You, me, everyone is getting results in homeopathy, but it doesn't have to be a shot in the air that hits accidentally. No, we have to be consistent in the results. And also this method, whatever we have learned in Gurukul, it gives us the confidence right at the time of prescription. And thanks God, it usually turns out very good. So how to be confident in that prescription and how it helps? Let's begin the case. Yeah. So this is a case of 61-year female. I have purposely not written it's a case of grade 3 fatty liver and gallstones, but because we are not treating the pathologist, we are treating the person. So I demonstrate it as 61 years old female presenting with grade 3 fatty liver and gallstones. Grade 3 fatty liver, if you must be knowing about this, it's a pathology that has very much advanced. The liver has quite much been damaged, and cirrhosis or fibrosis of liver is the next thing to happen. And traditionally, they don't see much hope with grade 3 fatty livers. So the case was started in August 2024. This is the very first report of the patient in August 2024. I have highlighted the things for you. It clearly mentions it's a grade 3 fatty liver. It has at least 3 calculi, largest measuring 8.3 mm, and the wall thickness is normal. Why I mentioned wall thickness is normal has some context that I will come up with you later. So what are the patient details? Name I have kept confidential, obviously, and the date of consultation and all these things. Socioeconomic background, she comes from a rich and cultured family background. Why is it important? We'll see. She is married for 30 plus years, and family structure, she belongs to a joint family. She has multiple responsibilities and other things. The chief complaints, where the case begins. She came to me presenting with gallstones and grade 3 fatty liver. It is ultrasound confirmed, and the ultrasound reports you have seen already. Apart from this, she talks very less about the reports and immediately starts about her chronic generalized weakness, especially in the legs, and it worsens on exertion. She says that I have to exert a lot even to get out of the bed and do my daily routine things. She has progressive weight gain and she has been obese since her early life, hair fall, and some other small problems that she presents with. Also, she mentions that she has a hypersensitivity to medicine. Any allopathic medicine she takes, she already has diabetes mellitus to mention, and any medicine she takes, maybe it for fever, maybe for cough and cold, anything she takes, it causes her sugar levels to rise. Past history. She had COVID in 2021. The COVID was severe. And even after the recovery, blood sugar levels started to rise. And weakness has never recovered since then. Recently, almost a couple of years back, she suspected flu-like illness. She told that it was something like swine flu with all the influenza-like symptoms and all. And it was also followed by her decline in general health. Since that time, her body has remained upset and immunity has weakened. The sense of vitality has quite much reduced and she gets sick quite often. Family history, there is no significant family history there. Physical generals, appetite is normal. The only thing is important here was that she mentions that sleep is very much disturbed and it is not refreshing. Whenever she gets up in the morning, she says that I don't feel like getting out of the bed and I'm not comfortable with anything. It takes me a great effort. It takes me a great effort to get out of the bed. Okay. And also she has obesity and other things. And menopause was normal. From the observations, she says that she is flabby and I see that she is quite flabby. Whenever she enters the cabin, what happens is some flesh is hanging here. Her biceps are hanging. Her every skin is loose and like this. Also, she is very soft spoken and she answers very politely and slowly always. Now we go from the case notes. These are the case notes translated from Hindi and Punjabi, our local language here. She says that I have back pain. It all started with weakness. The weakness started after COVID. I had severe weakness now. I cannot do much. I need a lot of support. I cannot take even the medicines. They do not suit me. I have to stay with the weakness. If I take any medicines, my blood sugar levels surge. So this we can convert into rubric. These are all the fact level informations that have come up to us. I hope you are acquainted with the levels of experiences and this is a fact level information that we get. So when weakness was coming up so prominently, I didn't ask much till this point. This is what Sir has taught us as the case overview. The first 10 minutes in the case taking, we see where the patient is leading us to. And she's emphasizing very much on the weakness. So I take it as a strong concomitant, as a hotspot, and I just inquire about this. I said, describe the weakness in an attempt to go one level deeper in the case. She says, it's like that I cannot move. I want to move, but I have to exert a lot to even move a bit. But I have to move anyhow. I have to do the household works and everything, but it is simply very difficult for me. This I have mentioned you already. Now we come to the mental state. She says, I do not like anybody laughing at me, especially at my physique, my look, my obesity. I always used to think, why I am not able to do anything for this. Here we can see a bit of How is that moment for her when somebody laughs at her? It is triggering something and it is coming right from her childhood. So we can take a rubric here that maybe delusion laughed at. But since delusion, it's a level 4 information, we'll try to go a bit deeper into this. This is the art of case taking that we have learned with Sir. So I ask, how does this moment feel to you when somebody laughs at your physique? She says, I feel very bad. I feel that I am insulted. Again, a delusion. I need respect. I'm insulted in front of anybody else. The emphasis she gave on anybody else was important. I have spent whole of my life in such suppression. In Hindi, they say, 𝗨𝗏𝘁𝘄𝗃 I have spent my life in such suppression and domination. Though nobody was actually dominating her. Okay, when the patient is speaking, we just give a nod. More. I feel like I am a 𝗟𝗲𝘁'𝘀 This was the term that I have heard for the first time. 𝗟𝗲𝘁 translates to a 0%. 𝗟 is 0, _ADMI is person. I have to tolerate it. I have to keep patience. I handle the situation somehow. I know that I cannot do anything. So I'm not able to do anything is coming up again and again in the case. So this was something that came very, characteristically, 𝗟𝗲𝘁 I have heard for the first time somebody describing self like this. So I ask, what is 𝗟𝗲𝘁? She says, it's a person with no feelings. You just have to work and go to sleep. There is no charm, no joys, nothing. I was basically fond of my many things. I enjoyed so many things. I was bubbly, but now I'm just getting more and more suppressed. Basically, I belong to a well-to-do family, but I am married in a small town. Here, there are no outings. My husband doesn't take me out, and he is also right. She doesn't have complaint with the husband even here. Our town has no place to go. I just have to remain inside. So I suppress myself so that the family stays together. I do not want to lose the good things at least. So here we can easily, have many rubrics, jump to some conclusions, but no, just stay with this. This patience is something that we have learned from Sir. So I ask, describe this 𝗟𝗲𝘁𝘀 a bit more, this 0%. She says, this is physically and mentally bejan, physically and mentally powerless. Now, if you could remember it, the people who are familiar with the sensation method, sensation is something that is felt in physical and mentals at the same time together. So this is very characteristic for me. I cannot do anything. I cannot feel anything. It is for just being there. That 𝗟𝗲𝘁 is just for being there. It has to be there. So this was all coming very slowly. It's maybe at least 10-15 minutes that I was listening to her patiently. And then I see, how does this being powerless, because it was physical as well as mental, how does it feel in your head, chest, abdomen, arms, and feet in your body? So she says, it doesn't feel actually at all. It is just like it is. Like you can imagine a log of old wood. It just is. It cannot move. It's just lying there. It wants to move, but it cannot move. Okay, how does that feel? It feels heavy. Now the information is coming very slowly, but I'm just putting it up front for you. It feels very heavy. It feels like a weight. It's like a log of wood, I told you. Okay, close your eyes, feel it, and speak. This is how we deepen the experience to see what is there in the inner cell. She says it's very heavy on the eyes. Then after a few seconds, she says, now I can feel the heaviness in my shoulders. Yeah, now I can feel the heaviness in my chest. I'm really feeling difficulty in breathing. It's घुटन हो रही है. I can't breathe. Can I open my eyes, doctor? I cannot keep it closed for long. I'm feeling suffocated. Please open the door. And she requested, and we had to open the doors for her. I cannot go to Vaishno Devi. It's a shrine in northern India. And I cannot go into the caves. I feel I shall die. So this was the deeper level that I could access. Then I go to probing the other areas in the case. I asked, tell me about yourself more. Then many routine things come up. I was married in a joint family. I had responsibilities. in the responsibilities, I was just like, just do your duty and you just feel and think nothing. Like I'm a person who can feel nothing. But basically, I was not like this. Basically, I was very shocking. I was a lively person. I was a bubbly person. I would like to do cooking. I would like to do some art and craft and this and that. So many things I would like to do. Okay. So I asked about the fears, just nominal things came up. Same about the anger. She again says that I have to bear it inside and I can't do anything for it. Not able to do anything for anything is something that's coming again and again. So I asked about her hobbies. She says, I love to learn something new. I enjoy doing such things. For me, it's like time passes very easily then. It shuns my boredom. The boredom comes from that the fact that I have to stay inside the home. I can't go out even for some time. But now, whenever I do something like this, I feel that that boredom has gone out for some time. Okay. She just feels joy in this. Effect of disease on you. I'm not able to do any of my work. I don't feel good about myself. I also want to be healthy and live happily, doctor, like this. So let's analyze the way most of us do. We have a case of gallstone. Okay, we have the first rubric, gallstone. Nature. Yeah, we can see that it is reserved. Yeah, she's timid. She's not reacting. Okay. Also, yeah, we see a lot of anger suppressed. She wanted to say and these things and this, and she does. And also, yeah, she mentioned that I am sensitive to that the people laugh at me, maybe delusion laughed at, delusion insulted. And yeah, fear of closed spaces, she said very correctly. Let's all just put it right into the repertory and see what pops up. And a repertorial chart comes up which covers no medicine. No medicine is covering the whole totality. What to do? What happened? I have put the exact rubrics, but what's it happening? No, we often used to land up in such chaos, but thank God now it's quite less. So what to do? Let's separate grain from the chaff, considering what is peculiar and leaving what is common. Common not just to pathology, but what is common to socioeconomic background, what is common to a gender, what is common in a life situation. Let's all keep it separate and just focus on what is peculiar and important in the case. Also, we organize and prioritize the data from the levels of experience. So we have already reached the level 5 and even 5C level, that is the source language level. How? Let's see. So now we look at the 5 fingers of the case. First, clearest aspect. First, we always pick up, sir has always taught us that do not just classify things. Start with what is the clearest aspect of the case. So in this case, the clearest aspect came when I inquired about her weakness. She, whenever inquired about how does this feel within, she says, I feel a lack, or I do not lack, I lack the power to move. This is what she says in her words. So this gives us the mineral kingdom. And going further, when this weakness was brought, it exactly comes up as inability to move at all. And there is a total lack of reaction. And this information, lack of reaction, was not a fact level information, but when I was probing and into her deepest levels of experience, then it came. So it was level 5 information, which translates to that it is the carbon group of remedy. Now we have so many carbons, which carbon to prescribe? Let's wait for the next 4 fingers to come up and tell which carbon is this. Second finger, we see the similarity at the other levels. Who is this person? We have to understand who is this person, kind of person. She's a submissive person. She is unreactive. She's a feminine person. She is very caring and not demanding of care. She's somebody who has affinity for colors. She enjoys her artwork. That pleasure, that simple pleasure, and bubbly, and all these things give up hints towards the second superclass, which again carbon belongs to. So I get another confirmation that yeah, my superclass is also correct for this case. Third finger I took as the source qualities. How beautifully she describes, it took her 7-8 minutes going deep into her experience and describing that heaviness that starts from here, goes here, goes here, goes here. And as the chest congests, she says, I am suffocating and I just want to open my eyes. This is exactly the fetus coming out or just getting lodged in. This is the birth process, and this translates to the second row of the periodic table. We call it as the source qualities of the remedy. So now we analyze the case. We are already that we have to give some carbon remedy. Which carbon will rely with the characteristic symptoms, the fourth finger in the case. So we take the symptoms, intoxication after medications, any kind of medicine she takes, she gets a adverse effect. The rubric is intoxication after medication. She has not been well since the COVID and then the flu-like symptoms. Any such illness occurs and she doesn't recover from that. And weakness is the main thing. So another rubric. And sleep unrefreshing. It is a rubric that is very marked for her. So the remedy should also be having this symptom in that marked intensity. This is also a kind of similia in terms of intensity. Okay, so 𝗂𝗶𝘃 does come up. Should I prescribe 𝗂𝗶𝘃 right here? No, I'll wait. I'll still cross-check that is it the 𝗂𝗶𝘃 only or I have to look somewhere else. So I go with the fifth finger. I do some another rubrics. I thought just let's check. Abdomen, fatty degeneration of liver. Again, 𝗂𝗶𝘃 is present and answers slowly. That was with her. Again, 𝗂𝗶𝘃. The remedy given was 𝗂𝗶𝘃, and let's go with the fifth finger as well. That is the keynotes. I have taken keynote screenshots from two places, Fatak's Materia Medica and Sir's random notes. It says it is suitable for chronic condition where there is a total lack of reaction. Typical 𝗂𝗶𝘃 patient is fat, sluggish, lazy, and a tendency to chronicity of complaints. Exact description as we see in the case is there mentioned in the remedy. This is, sir, what something that Sir says as black and white match, as it is in the remedy, as it has to be in the patient. Okay, and if you need read Sir's notes, it says one of the finest indication of 𝗂𝗶𝘃 is when the patient comes and reports that he has never been well since the attack of some infectious disease. 𝗂𝗶𝘃 is considered almost specific for this, and never well since you should put 𝗂𝗶𝘃 in one's mind after attack of pleurisy or any acute infection. She also twice she had acute infection and twice the complaints started or worsened for her. Okay, so we gave 𝗂𝗶. Now let's see. Yeah, another question that always comes up to our mind. Okay, if I'm thinking of 𝗂𝗶, okay, let me cross-check. Is there fanning desire? Sir has mentioned that 𝗂𝗶 is the classical rubric of the walls are falling into him and all this thing. But the patient didn't mention anything like this. How can it be 𝗂𝗶? Well, my dear friends, this is the biggest prejudice that we have unlearned. The 5 days, 7 days drills that we undergo into the TOS sessions at Mumbai are, we just not bring some knowledge back. We also, throw out some knowledge. We also unlearn there that this is not to be done. So, my dear friends, Sir has taught us quite well and it has helped us so much that we have not to keep fixed materia medica pictures in our mind. But what is significant in the case has to match in the same significance in the remedy. This is better similia rather than just having drug pictures in the mind. Okay. So, yeah, important thing, how to follow up this case. In the follow-ups, every month we access where is the patient's level of experience. And we choose the potency and even maybe remedy accordingly. If the state has changed, we may need to change the remedy. Also, in such cases, we have to get ultrasound done every 3 months. Why? We have to see is the remedy really working or not. And also, in the cases of gallbladder, we have to see what is happening with the gallbladder wall thickness. If it is less than 3 mm, we can understand that some perforation has started to happen and we advise accordingly. Do you know that if it is less than 1 mm, you should think that should I take the case even, or I should at least inform the patient that you can land up into an emergency anytime. So we have to be aware about this allied knowledge of the pathology and practice of medicine as well. Okay, so I got the ultrasounds done at every 3 months. Now let's see what comes up. This is the very first ultrasound. when the patient started, 21st of August. It was grade 3 fatty liver and at least 3 calculi, each measuring 8.3 mm. Wall thickness is normal. Okay, very good. So what happens after 3 months? December 2024. First was August. This is December. It says that it's a mild fatty liver. Wow, grade 3 fatty liver has come down to grade 1 fatty liver. This is wonderful. And what about the gallstones? It shows some sludge and stones up to 5 mm. From the previous 8.3 mm, it has come down to 5 mm. Okay, we'll continue with the remedy. Actually, the level of experience was the same. So we continue with the same patency. Now, March 2025. It shows gallbladder, no evidence of any hypoechoic structure. Gallbladder is well dilated and it is functioning. And fatty liver grade 1 is still persisting. Maybe it will improve in next couple of months. But however, the patient didn't turn up after that. She's doing well because her family members do come. So this was a small case presentation from me just to acquaint you with that, how the things happen. And this is what happens when you stop guessing. I think it can be that remedy. Another keynote sways me to another remedy. No, that is something we are not supposed to do. And we start learning the right way, that is structured, deep, and coming straight from the master. I must mention, master here doesn't mean that a person who is teaching since so many years. No, master word has been used only because sir has given consistent results in researches, in the COVID research, in the GM research that we talked in the recent seminar. So it's the fun, it's the joy and of not just learning, but getting transformed into something else. Thanks to Gurukul and thanks to five finger method that we could solve, not just me, so many of my colleagues, they have showed you cases. So based on all that, I present this case, I conclude my case, and I invite you all on board to the Gurukul journey. Thank you.
Wonderful. Thank you so much, Dr. Piyush. That was an amazing case. And I think that's also what we want to show all of you, is that it's possible for all of you to do the same. So we selected for tonight two cases which are more on the pathological side. So we can see, pathological changes in the liver, calculi, etc. And you can see that this method that we are trying to convey and what we are wanting people to do is very reproducible, it's very reliable, it's very consistent, and you can have faith in what you're doing. You can take a patient in with, a grade 3 fatty liver, and you can be confident that you're going to help them and that they're going to do better. And that is the aim of this Gurukul, is because we are sure that all of you, most of you are practicing homeopaths, you've seen homeopathy, you've seen cases work. But have you seen case after case where the patient comes and you know that you can help this patient? So this is our idea in Gurukul, where we make you, give you that confidence, where you can come and see case after case after case, pathological cases, and you will be confident that you will get results and that you will help the patient. So thank you, Dr. Piyush, for illustrating that. And again, let's keep moving and keep going with all the great learning. So next we have Dr. Manish, who has a beautiful case for us, extraordinary. So let's see this case. Thank you, Dr. Manish.
Thank you, Piyush. It was learning for me. And there is a question that there was heaviness, sensation. How do you differentiate from hemimelody? I think that belongs to the plant sensation. There is a sensitivity and reactivity, and your case was mineral, because there was lack of capacity and all those issues were there.
Yes, Dr. Manish, may I just stop you for a minute and just add a line to this? We were also getting swayed in the initial cases of Gurukul, that one sensation came and we would land up to hemimelody. In fact, Gurukul taught us how to see the case in totality and not just getting swayed by one thing that came sporadically, but rather seeing the whole case in totality, if I could convey.
Great. So let me start by sharing my screen. So I hope it's visible to everyone.
Yes, we can see.
So it's a very complicated case of renal cell carcinoma. I'll share the reports first. This lady, 39 years old, she belongs to a very underprivileged family, and she was going through some excruciating pains and all, but she was not going to the doctor. So ultimately, when condition became unbearable, she had to go for a medical opinion. And on 9th February 2021, she got her first scan done, which reported there is evidence of heterogeneously hypoechoic lesion with peripheral rim of calcification measuring 60 by 55, 51.5 mm in kidney, right? So there was suspicion of that it might be a neoplastic lesion. So on 15th February, CT scan was done along with urography, which again referred, that there is similar size, maybe it's even bigger in this mention. It's a neoplastic renal cell carcinoma. Going for further, she was planned to be operated on 19th Feb. She was admitted and she was discharged on 22nd Feb. This is very interesting. Why did that happen? That patient was presented with above complaints, all the pain in abdomen, the hematuria with clots and all. But operation was deferred due to locally advanced tumor, and inoperability was explained to the attendants. So what happened was the patient's abdomen was opened and they stitched it back because they said, sorry, we cannot operate it. And this was explained to the family as well. So being underprivileged, they came for the, homeopathic support. They were just given some painkillers, Drotin, etc. And they went to other doctors, but it was becoming helpless. So let us see the case. What was the case? I already told that patient is poor and they cannot afford treatment. So they came to homeopathy. Somebody sent them to me. And what was happening was that she's passing medium-sized blood clots along with blood while urinating since last almost 10 years, 8 to 9 years. And the urination would become very, very painful. The occlusion would become, the clot would occlude the urinary pathway, and it would be beyond the tolerance limits of the patient. But we need to see what's happening here at the fact is that she is tolerating this amount of excruciating pain since so many years. Almost 3 to 4 times a year, this is happening to her. And she never went to a bigger hospital. So now what has happened is the amount of bleeding has increased a lot. She's passing a lot of clots and the pain is unbearable now, along with vomitings. She has started becoming weak because of anemia and blood loss, and the weight is decreasing. She is doing a stitching job. She's a tailor, basically. She does beautiful work for the ladies of the village around. And she has now weakened a lot. The vertigo has set up. And she's the only, earning source in the family. And I asked her, this is the whole concised idea of the case I'm sharing with you. I asked her, what are the things bothering you out of this situation in your life? And what she said was, my main concern is not my disease, but my young son. I'm very anxious about him. What will he do? He is not studying that much. Will he get settled in the future? He is very delicate. Sohal means, it's a Punjabi word, means he is not having good endurance. He is not having a high capacity to work, to perform in any kind of situation. That's what her feeling is. And we understand that what patient feels for others is actually their own experiences. He is not working that hard. He is becoming very tired easily. My life after marriage is much better as compared to my father's house. In my father's house, I did not receive that much love. My father-in-law appreciates me a lot. So you can see there is some acceptance, appreciation issues that she's talking about. Then she shares about her father, that her father was an alcoholic. He did not walk, he did not fought for the poverty of the house. He abused me, he tortured me a lot. I was the eldest. In spite of whatever health problems I was going through, I ignored all my health problems and took the responsibility of family, that I will bring my family out of this poverty. Home environment was very brutal. Parents used to fight with each other a lot. That is what I grew up to. I was seeing my parents fighting with each other all the time. And with my parents, especially with my father, it was a kind of love-hate relationship. And the environment of home was very suffocating. I wanted to run away somewhere because I was sick of seeing this all the time. Inside, I blame my father for my condition somewhere. And also she's saying, I was not present in front of him when he died. You can see this is a kind of love-hate relationship. He did not take even basic responsibilities of family seriously. So that's why after he passed away, even in his presence also, I had to take on the responsibilities on myself. I worked very, very hard for my sisters. I got them settled. I got them married. I did my +2 without my parents knowing it. You can see the intention of the patient is not to just settle. She wants to aspirate for more. So we can see her situation is that even in so much pain, I used to work, and study, and my aim was to uplift my family from the suffering of poverty. And even I did so much, my parents never appreciated my efforts. They were just busy fighting and blaming each other. I was always hoping one day my father will appreciate my efforts, but that never happened. So she's talking about appreciation again, acknowledgement again. Then we see that she's mentioning about one teacher that she got in her, education time. For first time, this appreciation was felt by her, by someone. She felt I belong there. When my teacher used to appreciate, I would feel more enthusiastic and I would feel like doing more out of this appreciation. My desire to work hard would increase. He would give me a lot of homework and I would do it happily because he also wanted to refine me in some way. So even, I would do homework of my good friends, even in this pain, in this difficult health situation. When I would do that, I would feel that I have achieved something. I have done something in my life. I was clear that I have to work and achieve something in my life. I have to become responsible for others in my family. So I never focused on arguing or fighting with anyone. But in the worst situation of my life, I became tough. I became tough to bear the circumstances. I adjusted, I tolerated, and I worked and I worked and I worked. And out of this all, I was expecting someday my dad would stop drinking and see my efforts and he will appreciate. But that never happened. Again, this is coming, this appreciation, especially by father. Even an unbearable pain, I kept doing my best. Even my mother would never appreciate. She was so frustrating. She was herself so frustrated from the situation. She would beat me out of that frustration. I would hate that. My feeling is, why are you making me suffer because of your situation? I never felt included in my family because they never, included me. They never accepted me. They never appreciated me. But still, I felt the responsibility of my sibling is on me. I asked a little bit more about the history. There was a summary I'm sharing with you that she has always the interest of participating in sports, running, especially. Dreams of accidents, dreams of her body mutilating, like she has gotten a very grave accident where her body parts are getting scattered. There is heaviness of menses during periods. There is history of frequent UTI. I would share the follow-up quickly first. In February 2021, when she started the treatment, the pains started reducing. The blood and urine, that also, the clots became smaller. She came after a long time in May. There is no blood in urine. There are no clots. And the pains are minimal. In September, no painful symptoms, no clots. Patient is almost symptomless, enjoying her work. There is overall improvement in her state of mind as well. Patient is not ready for investigations again because of her financial. She's saying, doctor, I'm fine. Why do you need investigations and all that? So I insisted patient to get done the investigations. So I'll share the investigations that were done in February 2022, almost after a year when she started the treatment. You can see here that there is just lithiasis and 5.5 mm detected here, 4.4 bilateral nephrolithiasis. You can see the size has gone so much smaller. And again, in April, just after the Hanuman birthday, the nephrolithiasis only remained on the left side, which are also like very small concretions, not big stones. You can see just one blood report was also done, and the pus cells were 8 to 10. So we'll see, we'll understand the, how we approached the case. We can see the physical aspects in the case were It's a destructive pathology. It's a cancerous pathology. The situation is beyond control. It is, I should not say almost hopeless. It is hopeless when a patient is opened and stitched back and sent home. There are discords in family. There is financial burden. There is feeling of no appreciation. There is feeling of being forsaken. But still, she wants to take the responsibility. There is also ailments from death of loved one, along with the love-hate feeling with the father, from which she needs appreciation also, but also hates at the same time. So taking over responsibility of how patient reacted to this situation, taking over responsibility of family, becoming workaholic. The main word is stoic. Stoic word refers to very high level of endurance of pain, and you keep working, the amount of pain you feel more, the more you become numb to it and more you work. That is the stoic. Unappreciated, forsaken, but still ambitious. And if we see kingdom aspects, there is no lack of capacity we are seeing. There is no sensitivity or reactivity we are seeing, but there is a victim feel. She's blaming someone for her condition. She's hating someone. And there is a strong ingredient of hatred. So we have the animal, subtle hints for animal. And also, many people said in the chat, mammal indications, anxiety about children, need to belong to group, victim feeling, heaviness of chest, especially before menses. Now, which mammal? Before that, we also understand what kind of superclass it is, what kind of overall general experience of her life is, that she's feeling suffocated. She wants to run away, escape from that situation. But also, she's compromising with that. She's doing a lot of hard work. There is sense of achievement. This is fifth superclass experience. We can see there are a lot of superclasses, as we saw Piyush's case belong to just open and shut. There is dullness, so much dullness in the case. And I will not talk a lot about the superclass. Come join Gurukul and experience more, learn more about it. But this is how we understood. Now, what kind of remedy we need? That a remedy that needs to be appreciated by the master, by along with need to please him. There is a lot of sense of duty, conscientiousness, responsible, ambitious, hardworking, stoic, running, sports, sacrifice, duty, idealistically rigid. So much more we can understand. This is all we understand. In short, I'm sharing about this remedy. And if we understand the same remedy through the 5-finger method, we can understand there is finger number 1 is superclass. In every case, we do this in our practice now. We look at all the 5 aspects, and the accuracy and the surety in the recovery that is coming out is just amazing. Hats off to Sir, who has given us this tool to practice, to be sure in our remedies. We can see that it's an animal. We can see that it's a mammal. It's a multiple miasmatic remedy. There is tolerance for extreme pain. There is ailments from discords in the family. There is need to please a master. And you can see the result. The cancer is almost, it's not there. This is, I believe, a very inspiring result we can see with homeopathy, that patient is enjoying good health after being sent back home in such a condition that go die. Thanks to Sir. It all belongs to you, Sir. Over to you.
Wonderful. Thank you so much, Dr. Manish. I think it's a bit of an understatement when you say that it's inspiring for homeopathy. I think it's an incredible result. And thank you so much for sharing with us. Yeah, so if you're interested in learning this approach, how to do this, how to take on these pathological cases, you know, you want that confidence, the ability to, you know, see a case, walk into your clinic and have the confidence to say, yes, I can treat you, then the Gurukul is the type of training that we would like to give you. And maybe I can hand over now to Dr. Sankaran, and you could say a few words.
Yeah. One Dr. Smita is asking in the chat whether any other organopathic remedy was given or just lac equinum. And I think it is quite clear from Dr. Manish's case that lac equinum was the only remedy given and no specific or pathological or organopathic or any other kind of nosode or sarcode or whatever was not given.
Right, sir.
And this actually highlights that in pathological cases also, if you select the remedy for the patient, which matches all the aspects of the case, which aspects? Superclass, kingdom, miasm, and characteristics and keynotes, essence. If this matches, that has the absolutely best chance of healing, the most consistent, the most predictable, the most reproducible chance of healing the patient. This is what we learned from Dr. Manish's case as well as Dr. Piyush's case, where a gallstone, all these problems, they disappear with the exact remedy. And to come to that remedy, you need to match all the aspects. And for that, what is required? Required is you need to know all these aspects. You need to know superclasses, you need to know kingdoms, miasms, and you need to know just one second. You need to know the rubrics of the repertory. You need to know your materia medica and all of this. It is there to learn, you see. What is the most difficult thing in the world? The most difficult thing in the world is what you don't know, how to do it. You see. And what is the easiest thing to do is to do what you have learned, what you know. So the difference between easy and difficult is just learning, and learning how. Not learning shortcuts, not learning give this, give that. If it is cancer, give this remedy, that protocol, this nosode, this, all this kind of, this specific, this. No, this is not learning. This is confusing. And every different homeopath teacher is giving another protocol. Somebody is saying if you have cancer of this, you give this 3-4 remedies. Another one is saying another 3-4 remedies. Where is the consistency? Which is correct? And somebody is saying give miasmatic remedies. Somebody is give organopathic remedies, pathological remedies, this remedy, that remedy. In all this confusion, there is only one light, that is, give the remedy for the patient, not for the disease, for the state of the patient, and understand the state of the patient through the superclass, kingdoms, miasms, repertorial rubrics, and the essence of the remedy. So such a beautiful system is there for the taking, but it has to be learned systematically. And also, there are many ways of learning systematically. Yesterday, we explored the idea of the Sankaran master class, where you go from one module, second module, third module, right from the beginning to the very pinnacle. Sixth module's pinnacle is now released. That is one way. But the second way, which you can do along with it, is the Gurukul. In Gurukul, we take a very limited number of very good homeopathic students and practitioners, but especially practitioners. We don't take students. And we see that they are trained to the next level through a process of cases, through a process of live cases, recorded cases, mentoring, guidance. And we train them in every aspects of the game, the art of case taking, the art of analysis, the various 5 fingers. And also we train them in holistic healing, in diet, in meditation, in music, in wise processes. We also train them how to teach. And we also train them in a way how to be better human beings. This you can only get when you are in the proximity of the teacher. That is what the Gurukul is all about. And it arises from my desire to leave a legacy, to leave a set of good homeopaths behind me, because the very survival of homeopathy depends on the presence of good homeopaths. And we also teach them research. And I'm very happy to tell you that this Gurukul is the most fruitful, the most satisfactory thing I have ever done in my teaching. Systematic learning for 1 year, 2 years, and just mentoring them, seeing where the faults are there and addressing it at every point. And what we have produced out of this are people like Dr. Manish, Dr. Piyush, and yesterday you met, other Gurukul students like Dr. Prachi and Dr. Rachna and all these people. And I must say, I really very, very proud of these Gurukul students and see the type of cases Dr. Manish is presenting. It's not only, and Dr. Piyush also, and it's not only an example of a well taken, well understood case, it also demonstrates the knowledge of all the 5 fingers, of the superclasses, of the repertory, of the materia medica. And more than that, it also demonstrates their ability to convey this, to teach it. That is how it is going to spread. And here they are with us, inspiring you, to encouraging you to join the Gurukul. We also have with us a lot of non-Indian participants from different parts of the world. They are here with us today. And they cannot do the Indian Gurukul, but we have something for them. We have an international Gurukul, which is full now. It has started and there is no more space in it. But there is another opportunity which Kyle will talk to you about. Yes, Kyle, you can tell them a little bit about the Indian Gurukul and what an offer to non-Indians also.
Yeah. Yes. So thanks, Dr. Sankaran. So yeah, those people who want to, for our non-Indian friends, please stay tuned. I will be sharing information with you as well of how you can also join us and learn more. But for our Indian participants tonight, the Indian Guru, if you want to apply, you can do so at this website. Basically, it's a one-year course. It's starting from the 1st of September. All the information that you need, everything that you need to know is on the website. So I'll give you an overview now. It's a one-year course where we give you all sorts of content. We give you the masterclass where you sit and you work through the masterclass, and it's all included in the course with software, with certain books, all of this. So we give you an entire structure that we work with you through. Step by step, we guide you in this method, this approach. And also, you also have access to mentors. So there will be one-on-one mentoring sessions. I am one of the mentors. Then there's also another mentor, Dr. Sarah, and we help you, guide you, going through the masterclass, through the books. We talk to you about your difficulties, about things like superclass, WISE processes, for those of you who know about them. If you don't know about the WISE processes, even more reason to join, where we can teach you about an extremely valuable tool for case taking, analysis, and healing as well. So extremely comprehensive. I've seen many questions as well about, is it online, is it offline? So the Gurukul is a hybrid course. The majority of the sessions are all online. Every month we meet on Zoom. We send you material online. We give you access to the masterclass, which is online. However, then twice a year, so once in 6 months, you will come to Mumbai. You will spend a week at the 𝗏𝗏𝘁 and watch case after case after case. And Dr. Piyush had mentioned a little bit about this in his presentation, about how helpful it is. And this really is one of the gems of the Gurukul, is when you come in person to the 𝗏𝗏𝘁 and you see Dr. Sankaran take one case after the other and talk with you, discuss. Everyone works together, solving cases. And the amount of learning that comes out of that week is absolutely incredible and is a must. So these in-person sessions, incredible. We also have part of the in-person sessions, we also have a residential retreat where we take you and teach you about the WISE processes, how to use them, but it's all experiential. So you undergo the WISE processes, you come to the retreat as a participant. So this course is starting 1st of September. So we're really ending, going into the last few days where applications will be open. They are important that you get your applications in now so that we can consider you. So if you go to the website, the application form is on the website. You fill it in. There's an attachment. We ask you to send in various details. It's all there. However, if you're having any difficulties, any doubts, you're not understanding what to do about the application, or you have questions about the course, about the mentoring, about the in-person sessions, about the masterclass, about the resources we give you, you're more than welcome to be in contact. I will come back to that, but you can be in contact either with this email address, which is the sankarangurukul@gmail.com, or you can use my personal email address as well. I respond to both of these, so you're most welcome to use these emails. Please do contact me. Any queries, any questions you're having any difficulty, send me a mail. So that is for our Indian Gurukul students. Please apply. Even if you have any doubts, you're not sure about any aspect of it, just apply. We can always see how we can make it work for you. Now, for our non-Indian friends, our international participants, as we said, that the international Gurukul is no longer available. It's fully booked. We can't fit in more people in terms of mentoring, and that it's a bit beyond our capacity. However, we do have an opportunity at the beginning of 2026 called the My Week with Rajan, and this is also an in-person session in Mumbai at the 𝗏𝗏𝘁. However, on top of this, we will also be giving webinars where we will be having a few pre-seminar webinars, where we'll come on, we'll show cases, we'll really bring you up to speed, so that when you come to Mumbai, you are in touch with all the latest and the greatest methods. So this will be starting, the in-person session will be in 9 to 15 February. And if you contact me, I will let you know all about the details and all of that. So please write to me. Again, my email address is here. If you're interested in coming to Mumbai, being part of these online webinars, you're most welcome. And I will give you all the details and help you with any problems that you're having. So yeah, I think that's all from us tonight. Thank you very much for joining us. We hope that you were inspired by these wonderful cases and pathological cases, you know, and seeing all the different information, how we use it, and how you can, you know, upgrade yourself and gain access to this knowledge and to this approach. So if it's inspired you, please apply. Let us know how we can help you. We would love to, this is our main goal, is to spread good homeopathy, and we would love you to be a part of that journey. So thank you, everyone. Please write to us, visit the website, and we will be in touch. Lovely. Thank you, everyone. Good night.